Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Have you ever wondered what chronic myeloid leukemia is and why it happens? This condition is a form of cancer that targets our blood cells and bone marrow, silently wreaking havoc within our bodies. It is a complex disease that puzzles and challenges even the brightest minds in the medical field, yet understanding it is crucial to fighting it. So, let's embark on this journey of discovery. In this video, we peel back the layers of chronic myeloid leukemia, its causes, effects, and more. So what triggers chronic myeloid leukemia? This form of cancer typically arises when there's a mutation in the DNA of our blood cells. Think of it like a computer glitch, but in our body's coding. This glitch creates an abnormal gene known as BCR-ABL, which leads to the production of a rogue protein. It's this protein that instigates the production of too many white blood cells, the hallmark of chronic myeloid leukemia. Now, you might be wondering, why does this mutation occur? Truth be told, the exact cause is still shrouded in mystery. It's like an unexpected plot twist in a suspense novel. However, it's important to note that this mutation is not hereditary. In other words, it doesn't run in families like some other types of cancer. With the causes now clear, let's understand how chronic myeloid leukemia affects the body. Chronic myeloid leukemia's effects on the body can be quite severe. This disease, often abbreviated as CML, primarily affects the blood and bone marrow, the soft tissue inside bones where blood cells are made. At the heart of CML is an overproduction of white blood cells. Now, white blood cells are usually the good guys, our body's defenders against infections. But in CML, their numbers skyrocket beyond normal levels. This unfortunately doesn't mean superimmunity. Instead, it crowds out the other essential blood cells, like red blood cells and platelets. The result? A cascade of symptoms that may seem unrelated at first. Fatigue and weakness creep in as the red blood cells responsible for carrying oxygen dwindle in number. Unexplained weight loss may occur as the body burns more energy to cope with the high white cell count. Frequent or severe infections might be experienced as the surplus white blood cells are often not fully mature and therefore less effective at fighting off infections. And then there are the potential complications. Due to the lack of effective white blood cells and platelets which help in clotting, the body may become susceptible to bruising and bleeding. In severe cases, the spleen, which works overtime to filter out the excess cells, may enlarge, causing discomfort or pain. While these effects may seem intimidating, understanding them is the first step to combating this disease. Let's recap what we've learned about chronic myeloid leukemia. This disease, often abbreviated as CML, is a type of cancer that starts in certain blood-forming cells of the bone marrow. Instead of a simple infection or ailment, it's a complex condition that's caused by a mutation in the DNA of blood cells. This mutation leads to an overproduction of white blood cells, which eventually crowd out the healthy cells and cause a host of health issues. The primary cause of this mutation is still under research, but it's clear that it's not hereditary or caused by any lifestyle factors. It's a random, spontaneous event that can occur at any age, although it's more common in older adults. The effects of chronic myeloid leukemia on the body are significant and often severe. Symptoms can vary widely among individuals, but common signs include fatigue, weight loss, and discomfort or swelling in the abdomen from an enlarged spleen. Some people may also experience night sweats, frequent infections, and a feeling of fullness after eating only a small amount. Diagnosis of CML is typically made through blood tests, bone marrow tests, and genetic testing, which can identify the specific DNA changes in the blood cells. The earlier the diagnosis, the better the chances of managing the disease effectively. In terms of treatment, there are several options available. Targeted therapies aim to attack specific parts of cancer cells, slowing or stopping their growth. Chemotherapy and stem cell transplants are other treatments used, depending on the stage and progression of the disease. Preventing CML is challenging due to its random nature, but regular checkups and being aware of the symptoms can aid in early detection, which can significantly improve the prognosis. Remember, knowledge is power, and understanding chronic myeloid leukemia is a critical step towards combating it. UMCC, your ultimate medical consultants connector.